In terms of providing care and support to patients, what we're aiming to do at Care Plus is be able to provide the right people at the right time to work with the patients and help provide their care and treatment in a cohesive wraparound fashion. So whether we're accessing the GPs or the community matrons or the pharmacists, either coming here to the service or going to people's own homes to provide that comfort, if you like, in their own homes and prevent them accessing hospital services should the need arise.
Care Plus team have gone through a whole, thing of not just your health, everything, which makes a big difference to you. You can keep getting a bit better and a bit better at a thing if you do it every week, whereas I wouldn't go out at all before, not at all. And it's made a big difference going out. It gives you a little bit more confidence, etc., Very, very good. We also had Age UK, and through that I got Jack, who was one of the volunteers, to take people out or anything just to give them a bit of confidence, when they were on their own. It had never been out before, and he came every week. He came down on his bike and I got a taxi. And it just got easier and easier. And at the finish, he let me go myself, you see. So, of course, I was going into the car myself. So I was going to be doing the same as when he finished, But he came for weeks and weeks and weeks. And then he used to come in and make me a cup of tea, which was very kind of him, Have a little chat, and then he used to off, Very, very kind he was. He was lovely. You could talk to him so easy. The big difference between me being so old and him being so young, it was marvellous how you could talk so easily. He was a very, very good chap. Very good. I missed him an awful lot. I did, really. I missed him a terrible lot. But Mary said she's got a letter from him or something, didn't she? So that'll be nice.
Since breaking a hip, she was in the Cedars quite a long time. She was in from November till January, and when she came out, she'd lost all her confidence. She was a very, very independent person before she went in, before breaking her hip, and when she came out, she'd just lost all her confidence. She wanted to be back in her house, but she didn't want to be on her own. She didn't want to go out anywhere, and it was very, very difficult because I felt as though, even though I've got a family, I felt as though I should be here a lot of the time, and I didn't want to leave her. I just wanted her to be back to being my mum and back the way she was, back to being independent. But since being involved with Care Plus, it's been amazing. She only has to make one phone call and everybody comes, and everything's sorted. She's been in touch with Mary, who's done wonders for getting her out and about, and everything just seems to be sorted so quickly, and it's so easy just to ring that one number for everything, and they're just really, really good. I can't praise them enough because it's made a massive difference to my mum and the rest of the family.
Probably in terms of Care Plus, the patient I'm most proud of is Mavis. When we got involved with her, she was just recently home from a period of respite. She'd completely lost her confidence, having had a nasty fall and broken her hip. She was having significant problems with her legs. She was socially withdrawn and really quite depressed. Working with the community matrons who helped sort out the swelling in her leg, working with Age UK who got her a volunteer who she was completely delighted with. We got her back to her weekly church lunch club, and the time I most remember is from our MDT when someone came in and said, "We've had a disaster. Mavis has gone off in the taxi without waiting for the volunteer." And we were like, that's not a disaster. That is what we're about. She's had the confidence to do that. It was hiding just behind you there. But because we've had a little bit more time, I'm not quite as rushed, I think, as sometimes when your own doctor comes in on a visit. So we've been able to go through a bit, and I think I'm right in saying in here, yes, we've got a bit of your story, and we've had a bit more time to sort of go through what's gone on, like when you broke your hip. The biggest thing as a Care Plus GP is having a bit more time. I haven't got any different skills to a normal GP, but I have got a little bit more time. So I'm able to go through someone's record before I go out, and then when I'm out with the patient, I know their story, and I know perhaps where I think we're aiming and which bits we can sort out. And I'm able to introduce them to the rest of the team, explain to them what's going to happen over the next couple of weeks with people coming in.
So the thing I've really enjoyed about being part of the Care Plus project is getting to work with patients in their own homes. There's something very different about doing a medication review with a patient in their house compared to doing this in the hospital or in the normal community pharmacy. You've normally got something like sort of 5 or 10 minutes with each patient, whereas I can spend a full hour sitting in the home, getting all the medicines out, and the patients really appreciate someone doing a full overhaul, take everything out of their cupboards, get rid of all the old stock, and answer any questions that they've got. Patients have often got questions, they've often been on medicines for years and years, but have never really understood them. So I found that's been absolutely brilliant, being able to be out in patients' houses and work with them on things like that. The other thing that I really enjoy about being with Care Plus is the multidisciplinary aspect, being able to work with the GPs in the same office, being able to ask them questions whenever I need. Same with the community matrons, and having access to people like Age UK and the social work side of things as well, so that we can look at people in a holistic manner and properly sort them all out from every aspect.
Previously I worked with 5 different practices, which meant that it was very hard to get to know well all of the GPs, whereas here working with just 3 GPs gives much closer working relationships. And the multidisciplinary team with pharmacists and Age UK, and then the wider team with geriatricians and mental health nurses and social services gives a much better communication framework for getting to the bottom of patients' problems and coming up with a plan to deliver care that's going to meet their needs and help prevent unnecessary hospital admissions.
I feel very positive about this sort of bubble of care that our elders are included in, and I think there are so many advantages to being with Care Plus, and that Age UK can sort of come in on a very sort of personal, non-medical level. So we can look at maybe their social interaction in their home environment to further improve that in any which way we can. And it may be in a very practical sense for their homes, provision of care, or just to be more sociable and improve their sense of well-being.
In my role as a GP with Care Plus, the best bit I think is our morning meeting. So every morning the GPs on duty, the community matrons and the pharmacist get together, discuss new referrals, but more importantly discuss just little niggles, little things that we've had difficulties with, things we're unsure about, and we've got a little MDT every morning to solve problems, and just chew the fat, just discuss the patients, which ends up for definitely better care for the patients because it's much more joined up than normal.
I think one of the things that I'm most proud of is the multidisciplinary aspect of the service, to come in from the voluntary sector and to be part of a health team and to really have our input appreciated is fantastic. And I feel that everybody within the team acknowledges what we can bring to the table, which is probably one of the things that elevates it above a traditional health service.
I became involved in this work back in February 2014. It was a real privilege to work with local clinicians and managers, partners from social services, from the acute trust, patients, carers, the voluntary sector. And this work was way ahead of the 5-year forward view. It was way ahead of new models of care and the vanguards, and it was a group of individuals who passionately wanted to improve local services. It was an absolute pleasure working with the executive team, working with their partners from local government, primary care and secondary care, and it also showed the complexity of real large-scale change and transformational change. Trying to put plans into action when it crosses organisational boundaries is one of the hardest things we can ever do, and ensuring that the patient is at the forefront of our thinking and our planning and our operational execution is again very, very difficult. This team 2 years later have managed to do that. They're starting to see the service benefits, and for me it's been marvellous today to actually hear that staff are having more time to work in a much more quality orientated manner. I congratulate the team because they have actually seen through complex transformational change and have managed to do that and have that change in line with national policy.